Hey, hi. Welcome to the new episode of podcast where we talk to the people who are associated with cardiovascular health. Let me introduce you to my trainers. Actually, they are my first trainers to start with. This is Shilpa and Shesha. Kindly introduce yourself.
I'm Shesha here myself. I'm a fitness coach and personal trainer as well as group instructor from past 15-16 years. I have done many certificates from American Council on Exercise, kind of nutritionist and biomechanic exercise specialist course, as well as newly I'm learning animal flow certification and etc.
Hi, I'm Shilpa and I'm a fitness trainer from past 15 years. So I've done Zumba certification and MMA, and I take personal trainings also and group fitness classes.
I'll start with my first question. What exactly is fitness for you both?
So fitness, where you can fulfill your daily living without fatigue.
Okay.
For example, you're into software company and you will be working almost sitting job almost 8 to 10 hours. So you may get back pain. So when you do exercise regularly, you will experience good life. I mean to say healthy life without having any back issues or shoulder issues or neck issues. So fitness is all about completing your daily task without any fatigue.
What do you think fitness is for a woman? It is totally a different thing for a man, isn't it? So, as a woman, what do you see? What do you mean by fitness for a woman?
Yeah, for me as a woman, fitness is most important for especially women actually. So for our daily living activities, like we'll be working at home and at the office or like anywhere to work with. So we need fitness. So we need to have that core strength, especially for women, to undergo the menstrual cycles and do the household, all the activities, take care of the house, everything. And even we undergo menopause. For us, fitness is the most important. Especially I recommend to do weight training.
Thank you. How important is mental health and physical health? What do you think that where the mental health will play a role when it comes to physical health?
See, people always spending more time for physical health, not mental health. So you're supposed to balance between mental health and physical health. Suppose if you're spending at least 1 hour for gym, you're supposed to spend 20 minutes for your mental health to practice deep breathing, which will increase your parasympathetic nervous system activation. What is parasympathetic nervous system activation? So it will decrease your anxiety and stress, everything. So that deep breathing practice is nothing kind of a meditation. That will increase your mental health and also it will increase your optimistic attitude. That is more important than physiological health. So when you have mental health, you will be getting physiological health as well. So you have to balance between both. It's not about only exercising for an hour and leading your life. That is not only fitness. It's a combination of mental health and physical health, equally important.
How do you tell your clients that mental health is equally important? You know, many of them think that okay, I come here and I do exercise, I pay the gym fee, out of which they'll come only for a day or two in a week. But how important it is for you people to motivate them to come here and maintain both their mental health and physical health? What do you do to do that?
See, for human tendency, when they get some benefit, they'll get motivated, isn't it?
Yeah.
So they should experience the benefit of coming here by leading quality life. For example, if they are experiencing some back issues or knee issues, when they come here, we will train them according to their requirements. So they will get some results like quality life. That's when they'll get motivated. Okay. Then mental health, I will keep telling them to do meditation for 20-30 minutes a day. At least start with 5 minutes. If they are not able to do it, I'll only put one session, post-workout session, 5 minutes of deep breathing techniques to increase their mental health.
Do you have clients who have lifestyle disorders like BP or cholesterol, high BP, high cholesterol, or sugar patient? How do you have special trainings for them? Do you design something like that?
Definitely. See, for example, blood pressure or diabetes, It's a combination of strength training exercise and cardiovascular exercise plus some kind of flexibility exercise and mobility exercise all together will increase their overall health. So we will plan such a way that they should be able to increase their health.
No, I mean, what I meant is, let us assume you get a client with a very high BP. What should they do first?
It's combination of strength and cardio only. So
They
we will
do
be
everything. Okay.
Yeah,
they
we
do-
will be focusing more on cardio endurance exercise to control their hypertension.
Okay. What about?
Hypertension is the big.
Yes. And what I want to ask you, ma'am, is let us assume you have an elderly lady around 60 plus who comes in, and she is, she wants to lose weight as well as maintain her fitness. How do you tell her that at that age what is important? And do you also screen whether they are deficient to any mineral or what are the different disorders they are undergoing? Do you do something like that? What do you tell them?
Yeah, initially we'll start with a very few 15 to 20 minutes of workout itself. If they are comfortable, then we'll keep increasing their workouts. So to start with, we'll be doing the core exercises, and then we'll be starting with the mobility exercises which they need. Like 60 plus means they lack mobility during that age. So main thing, we start with the mobility and we also train with the strength training. So strength training, it's not only like lifting more weights only. At their age, we can just slowly we can just start, or using their own body weight also we can just start. So that will add up on our fitness, and for the weight loss and all, we can just alter with the diet. Healthy eating, more of fiber, all that and all, we'll guide the client.
How important is protein intake nowadays? Everyone talks about protein, and especially for elderly people, should they take protein, or in Indian scenario especially, what should they do? Because today morning I met someone who said, I'm a vegetarian and I cannot get enough of protein, and I don't like mushrooms or paneer. So what do you tell such people?
Absolutely myth. Vegan people, vegetarian can have more protein compared to non-vegetarian. The reason is you have plenty of variety of vegetarian protein you're supposed to find.
Yeah.
And soya chunks is the best source of protein compared to non-vegetarian. It will give double the amount. For example, 100 gram chicken breast can provide 24 gram of protein, which soya chunks provides double that.
Oh.
So almost 40-45 gram of protein. So though you're vegetarian, you can meet protein intakes. I would say around 1 to 1.2 gram per kg is what required everybody.
Okay.
Those leading sedentary lifestyle as well. I mean to say, when they have good amount of protein, like per kg 1 to 1.2 gram of protein, their metabolic rate will be very good, because protein increase your muscle mass. Muscle mass is the most important for your metabolism, because muscle is most metabolic active tissue.
Yes.
So that is when the protein plays vital role. When you don't take sufficient protein, you will lose your muscle mass, then you will lose your metabolism. By losing your metabolism, again, you will not be able to burn such much calories.
Yeah.
Then you will gradually put on and you will become obese. And all problem is interconnected. So I would say protein is very important. It's not like that protein only bodybuilder should take. That is absolutely myth. Bodybuilder takes per gram 3 to 4 gram.
Oh.
Okay. So that 3 gram is something huge. So 1 to 1.2 gram everybody can take.
Do you believe in supplementing the protein, or do it at home? I mean, what do you suggest?
I would suggest for my clients to take protein naturally, because I follow that. I lead by an example. So I take my pumpkin seeds, sunflower seeds, and chia seeds. These kind of seeds and nuts provides protein as well as good fat.
Okay.
Whereas when you take only supplements, whey protein will give only protein, not the omega-3 and omega-6 fatty acids. So I would say natural is better. If you are not able to meet the natural process, you can go for a whey protein. But make sure that you're completing at least 100 gram of protein. Suppose if your body weight is around 80 kgs.
But a person can build a very good body, is it? They can have all the...
Definitely they can build muscle if they take natural source also. It doesn't mean that you have to take that whey protein or any other supplements. That is required when you are not able to take protein naturally.
Yeah. There is a new trend which is happening. Creatinine and gym goers and creatinine go together. There is a myth that the more you take creatinine, the muscle building is very good. What do you suggest?
Say creatine is instant energy. So when you take creatine, you'll be able to lift weight more. That's when you will build muscle. Again, you're depending on the supplement. So that is not good. It may, over a period of time, it may damage your kidney.
Okay.
But that's not sure. But I would suggest them to naturally process with normal food and lifting weights over a period of time instead of taking creatine and lift immediately.
But someone like a model would want an immediate result, within 2 months or 3 months he will have a shoot.
Then definitely they have to take the creatine and whey protein or fat burner, etc., etc. Shortcut is always not good.
And ma'am, for you, ma'am, what do you suggest? A woman after the age of 40, what should they do to maintain their hormonal health? Because there are a lot of fluctuation in hormones after 40 years. So what all should they do? What about the diet and the exercise part? You have already explained, but specifically can you tell me what should a woman do? Because many of them are confused whether they should go to the gym or they should do yoga or they should sit at home and only eat healthy. What should they eat? All these myths are surrounding women. So what do you suggest?
See, after 40 years, I suggest it's not only doing like workout or only doing diet. You have to balance between both. So you have to do the like proper diet and even the workout wise also. So start with after 40. If you are planning, any ladies are planning to start any workout, I suggest them to start with some cardio and weight training is must. So after 40, we tend to lose like 1% of our muscle mass like every year. So that is the best time, like at least if you are like, it's not the never the late, so at least after 40, if you are any planning to do any kind of workout, weight training is must, I suggest. So even the work if you are thinking about the diet also, diet is like whatever more of vegetables, protein is a must. Like protein intake also they have to increase. I recommend naturally to have it. Yeah.
What about pregnant women, ma'am? Should they work out or not? Because the moment they become pregnant, they stop coming to the gym.
Okay.
And walking is alone not sufficient, is what I feel. Nowadays, people are already obese. They get pregnant, they put on more weight, but they don't want to come to gym. Would you like to answer that?
Yeah, even pregnant women can exercise. They should listen to their body.
Yeah.
Their body. Some people can experience some discomfort. They can decrease the exercise intensity, and if they are feeling comfortable, they can increase the exercise intensity. That doesn't mean that you're supposed to stop during pregnant. So you can exercise. So when you exercise, the chances of normal delivery instead of going for a C-section. So there are multiple health benefits by doing exercise, even the pregnant or post-pregnancy as well. So they can work out.
Nowadays, there is this new thing which is happening. Many youngsters are dying, and they are relating it to going to gym. Especially when they are exercising, they are dying. And we all know that exercise doesn't have to do anything with their cardiovascular health. But what is impacting their cardiovascular health?
See, for example, previous night party. When you party so much and if you consume more of alcohol, your body get dehydrated.
Yeah.
Next day you will not be having that much energy and you're already dehydrated, and if you work out exercise with HIIT, like high intensity interval training, like where your cardiac rate will goes really up, like beyond 160, 170, 180, that's when the heart stops immediately. That's when that's nothing but cardiac arrest. So what I'm suggesting, you should have sound sleep previous night, then you need to do intense exercise. If you're not slept well, you're supposed to do moderate or low intense exercise, so you'll not be having any issues, such kind of whoever that youngsters or whatever. So that is the reason. Not good sleep and workout intensity is beyond what they're supposed to do. So if you do anything too much is bad. So you should be knowing your limits, and you can only understand your body better than anybody else. Your trainer also cannot be able to figure out what is going through in your body. So you should understand your body. I did not sleep well, I supposed to take it slow, then slowly increase the exercise gradually. So doing intense exercise and getting that kind of a problem, it's blaming the gym, it's not correct.
Correct. How important is that you train your trainers? How important is the certification? I know gym trainers are quite experienced, but where the certification comes into picture?
See, if there is no certification, you don't know what you're doing. If something, you should do what you know, right?
Correct.
So this is not only physiological, practical experience. You should have that theory experience as well. You should know the theory. If you know the theory, so that you will be able to understand which muscles are working for which exercise, so that based on that you can modify the exercise, etc. So if you don't have that certification, you will not be able to understand what is anatomy, kinesiology. Anatomy is knowing the muscle and bone name. The kinesiology is the function.
Yes.
So, for example, biceps muscle is anatomy, bicep elbow flexion is kinesiology. If you know kinesiology, you will be able to understand which muscles are getting engaged for which exercise. So, without certification, no, you cannot do that. So, that's why we always make sure that our trainers should be trained under us. Whatever we train them, they will teach our clients. So, in India, it's very common. If you have experience and if you have good body, you will become a trainer or you can become a coach, whatever, etc. So you don't have to have really that certification. Building muscle is different. Teaching is different. Building muscle, if you eat well and if you exercise well, you will get. But when you know the certification, when you know the theoretical knowledge, you will be able to understand what is happening in the body. So based on that, you can modify the exercise. So certification plays a vital role.
Yes. Because recently I was in a conference at St. John's Auditorium. The name of the conference was The Move, and you had the topmost gym owners there, and their trainers were not certified. They don't know what they're doing, and it might lead to an injury, isn't it? And gym injuries tend to be almost 4 out of 10. 4 injuries are from gym.
Correct.
So if they are not trained, then they don't know what they are doing.
Correct.
That is what
that is why if you go to doctors, orthopedician, they will tell not to exercise, because why? Instead of doing incorrect exercise, better to stay sedentary lifestyle.
Sedentary lifestyle.
So,
stay longer.
Yeah, that is for sure. If you are exercising, exercise correctly with your proper posture, with proper guidance. Otherwise, you'll gonna damage yourself like anything. So you are right, absolutely. Certificate is mandatory for these reasons. And see, when I myself, I did not have certification from, 14 years ago. I used to take a lot of aerobics classes. I did not know that this much wear and tear will happen when you do aerobic exercise with more body weight.
Yes.
Then I reduced my weight around 10-15 kgs from 90 to 70. Now I'm 78. Irrespective of muscle or fat, what I have, I will be having stress on my knee and ankle because it's a weight bearing joint. Yes. All that I learned from certification. So I personally experience, get it done. Certification is mandatory to know what you do. Yeah. You'll feel happy when you do something with motive.
Yes. Thank you so much, and it was a pleasure talking to you both, and hopefully we'll have more interviews with you both. Thank you so much. Thank you.